Good afternoon, everyone. Glad to see quite a number of people I haven't seen in person in a while. And as we give a update on COVID-19 in Erie County, we have not had an update in a number of weeks, and we thought it was appropriate based on some of the issues that we're seeing. Some good news and some not so great news. Of course, you'll hear from Dr. Burstein in just a few moments, but you're also joined by Kendra Schmidt from Deaf Access Services, who'll be providing the American Sign Language to all at home. Just first data, this is with regards to October 26th. This is fresh out of the Department of Health's epidemiological staff. This is actually one of the largest new cases we've seen in quite some time, 400 new cases. We didn't plan on holding this event because of the new cases, but the 400 new cases in one day is actually one of the larger amount of new cases that were confirmed on October 26th. Total new cases per 100,000 now for the last 7 days is back up to 191. We are still in the high risk of COVID-19 transmission category, which is anything over 100, so we're nearly double that number. And a little less than 108,000 Erie County residents have had confirmed cases of COVID-19, 107,831 in total. The last 6 weeks, we had seen a nice little declination in the number of cases, including the case rate per 7 days. But as you will see just before, because of the most recent couple days, we're back up to 191 new cases per 100,000 over a 7-day period. We had been dropping, and we're going back up again. That's not great, but these are, we sort of reached a height on the week ending October 9th, and we're starting to see a slight reduction. A little disappointed about the reports from yesterday. There's still a lot of COVID in the community. And as we'll talk about, there's still too many people dying in the community from COVID. But while total cases decreased, the number of cases in youth under 18 years of age has stayed steady. I know Dr. Burstein will talk more about that. One of the reasons we believe that's the case is because of the percentage of individuals who are actually vaccinated between the ages of 12 and 17. Approximately 50% of this age group are not fully vaccinated. And 50% of this age group accounts for 85% of the cases in the age group category. So what we're very worried about is, and we talk a lot about schools, and I'm sure there'll be some questions later, the best way to protect students is to get them vaccinated. There's a lot of pushback for some parents, but really the best way to ensure that your kids are in school, the best way to ensure that everyone is safe in school is to get kids vaccinated. And right now, 85% of the cases surveyed in the 12 to 17 year age group were not fully vaccinated. And approximately 50% of this group is vaccinated. So as you see, nearly 85% of the cases in the 12 to 17 is coming from only half of the population in the 12 to 17 age category. So if we were able to increase the amount of individuals who are vaccinated in the 12 to 17 age category, we expect a tremendous drop in the number of new cases in that age group. And this just kind of goes through the numbers of confirmed new cases per age group. And you'll see that the largest age group, based on number total raw new cases as well as cases per 100,000, is the 30 to 39 year age category, prime working years. So we do see that has the highest category, and we have seen, unfortunately, an uptick in the older age categories. They were very low for a while, and now the 70 to 79 is back up over 100, and the 80 plus is a little less than 100 per 100,000 persons in the past 7 days. So those numbers are still much lower, and one of the reasons is because such a vast proportion of those age groups are vaccinated. But as we know, you can get sick, you can catch it if you're vaccinated. That's why it's very important to get a booster. But it's still the largest number of cases are being driven by the youngest age categories, the age categories that generally have the lowest percentage of vaccinated among the rest of the age categories. Hospitalizations through the 25th, we have seen a nice little decline, not a huge decline, but a nice little decline in total hospitalized in the last 2 weeks. You will note that there has been a decline in the number of people in ICU beds, as well as those slight decline in the number of individuals who are on an airway assist. But one thing we have seen is truthfully an increase in deaths. I know in the last 7 days alone, there were 16 people that died in Erie County hospitals just in the last week alone, so more than 2 per day. As you can see, there were some other days in which we had some very high numbers. 5 people die in Erie County hospitals. We'll talk a little bit more about mortality and issues that we're seeing with it, but it's not totally surprising that when you reach your peak in hospitalizations, a little bit thereafter, 7 to 10 days thereafter, you start to see some increases in deaths. It's distressing when we look back at where we were the prior year in 2020, which of course we were deep into COVID and no one had been vaccinated. So we have this chart here. It might be a little difficult for people to see in the location, but I think it's important to see that in September of last year, we had 18 total deaths in Erie County. This is, remember, pre-vaccine. In September of this year, we had 55 deaths in Erie County. In October of last year, we had 31 deaths. And through October 21st of this year, which is the most recent data that we can confirm based on our review of health information, there have been 54 deaths of Erie County residents. So we already have exceeded October's totals as well as September. Now you see last November there was a big jump up of deaths as people started to go back indoors. This is pre-Delta. Now people weren't vaccinated at that point. Most people didn't start vaccinated until January. So when we talk about being concerned about the fall, this is why we're very concerned about the fall. We have had more deaths. If you look at August of this year, 41 deaths. August of last year, 11. September of last year, 18. This year, 55. October of last year, 31. This year, 54, which of course will probably get over 60 by the time we actually finish this month. Maybe even 70, I hope not. But in November, 149 deaths. So we are very still concerned about what could happen in the fall as more and more people go indoors. We have holidays that people are enjoying indoors. I don't, and I hope it will not be as high as last year. Primary reason, we have so many people vaccinated in Erie County. But it's not good when you see the total number of deaths for August, September, and October of this year, after we vaccinated so many people, be higher than last year. And the majority of those individuals who died were not fully vaccinated before they caught COVID. Since July of 2021, the average age of death was 82 years old for those that are fully vaccinated and is 68 for those that are not fully vaccinated. And Dr. Burstein will go into some additional mortality data with regards to those under the age of 60 and so forth. But it comes down to this. We have a lot of people, unfortunately, in our county in the past few months who died, who should not have died, but only died because they didn't get vaccinated. I don't know what to do at this point. We've offered everything, the shot in the chaser, the free beer, all that stuff, all the kind of giveaways. There are a certain group of individuals in our community who will not get vaccinated. COVID is one mean SOB. Delta variant is really bad. Dan Meyer was telling me a story of someone who caught it and basically less than a week later was dead. If you have not gotten vaccinated, it's almost a case of Russian roulette in some ways. It really is nasty, especially with the Delta variant. And I don't know what the fall is going to bring, but it's going to bring more people inside, especially going to family events and the like, that weren't there, maybe not doing the same things before because you could be outside. It was 75 degrees. It was beautiful out. We know that's not necessarily the case anymore. So the mortality data is very revealing. That we have had 807 individuals die this year. A majority of those, since at least July, we know, were unvaccinated. And if those people had been vaccinated, there's a very good chance a good portion of them, a high portion of them, would be alive today. So I've said it before, I'll say it again. I don't want to hear from a family or read about someone who died who then becomes a statistic on our mortality data in Erie County that could have been prevented if they had just gotten vaccinated. With that, I'm going to turn it over to Dr. Burstein to talk about the rest of the issues associated with COVID.
So I have not grown since August. Hello, good to see you all again. So I am going to continue talking about our COVID-19 situation in Erie County. So this first slide I'm going to present is new. You haven't seen it before. So we created it ourselves, so I'm going to walk you through it. So first I'd like to you bring your attention to the graph on the right-hand side, looking at the number of people in Erie County, a number of adults in Erie County who, by vaccine status. So the people in blue are the proportion of people in Erie County that are proportion of adults in Erie County, 18 and up, that are fully vaccinated. And yellow are the proportion of adults who 18 and up who are not fully vaccinated. And so you can see about 2/3 of Erie County residents are adults. About 70% are fully vaccinated, and about 70% are fully vaccinated, and about 30% are not vaccinated. So moving to the left-hand side, this is looking at similar data, but for the hospitals. So the people in green are people who are admitted to the hospitals with COVID-19 who are fully vaccinated. And the different shades correspond to where they're located in the hospital. So either in a regular medical ward, the ICU, or they're on airway assistance. And then the golden brown are all the unvaccinated COVID-19 related hospital admissions. And again, the shading corresponds to where they are in the hospital. So the lighter shade is either in the ICU or on airway assistance. So you can see that about 1/3 of people who are in the hospital are fully vaccinated, and 2/3 are not fully vaccinated. So you can see that the 30% of people who are not vaccinated account for 2/3 of all the people who are admitted for COVID-19 in the hospital. So that shows to me that the vaccine is effective, because this small population of people in Erie County who are not vaccinated, of course, account for most of the hospital admissions for COVID-19 in Erie County. So actually, CDC has a new graphic that they use to look at vaccine effectiveness for COVID-19. So this graph is looking at the rates of COVID-19 cases by vaccination status and by age group. So the dotted lines corresponds to the COVID-19 case rates among unvaccinated people, and the solid lines are for vaccinated people. And then the different colors corresponds to the different age groups. But I'm sure you can see very clearly that regardless of what color it is, what age group it is, the unvaccinated people have much higher COVID-19 case rates compared to the fully vaccinated people. And there's one age group that I want to bring to your attention. So this is our school-age children that are eligible to be vaccinated, the 12 to 17-year-old. And you can see that in the dotted line, the 12 to 17-year-olds who are not vaccinated have the highest COVID-19 case rates of any age groups, whereas the 12 to 17-year-olds who are fully vaccinated, they have the lowest case rates of COVID-19 of any age groups. So this vaccine is very effective, especially among our adolescents. So another end game that we look at with vaccine effectiveness is preventing COVID-19 related deaths. So here I'm going to present to you some data we have on COVID-19 related mortality by vaccination status. So looking at data from COVID-19 reports among Erie County residents from the beginning of July until October 21st, among all the deaths of people under the age of 60, only 4 were among fully vaccinated, and 23 were among people who are not fully vaccinated. And then looking at all the COVID-19 related deaths, there were people who were younger than 80 years. 94 of those deaths, among the 94 deaths of people younger than 80 years, 72 of them were among people that were not fully vaccinated. So you can see that the vaccine is very protective against still even infection, hospitalizations, and deaths. So these are also CDC data, similar graph as I showed before for case rates, but looking at the end game of mortality. So this is looking at rates of COVID-19 related deaths by vaccination status and by age group. So again, the dotted lines corresponds to the rates of death among the unvaccinated, and the solid lines corresponds to the rates of death among the fully vaccinated. And the different colors correspond to the different age groups. So looking at the data between July and August, when we were seeing a spike in our Delta cases, it's crazy, but the people who are in their 30s and 40s who are unvaccinated have a higher risk of dying from COVID-19 compared to our seniors, people over the age of 65 who are fully vaccinated. So again, that is evidence that this vaccine is very protective to prevent against COVID-related deaths. So let me talk about what we are doing in Erie County to keep our community healthy. So we are still testing. COVID-19 PCR testing is the gold standard of COVID-19 tests, and we are offering these testing at the nucleic acid amplification testing in the county 6 days a week, Monday through Saturday. So if anybody is not feeling well, please get a test. We're not the only ones testing. There are pharmacies, there are independent labs, lots of places you can get a test, and a PCR test too. So if anybody's feeling sick, please get a test, and please stay home until you have the test results. So in our Erie County Health Department, we are doing the PCR testing, which is a laboratory-based nucleic acid amplification test, Monday through Friday, and those results are available in 1 to 3 business days. We're also doing the point-of-care or the rapid nucleic acid amplification test, the ID Now test, and we're doing those Monday through Saturdays, and we are really concentrating our efforts to get the people who are either staff or students in K through 12 schools those rapid tests, because we want to get them back in schools. So those rapid nucleic acid amplification tests are really reserved for students and staff in grades K through 12. So again, we're only testing Erie County residents. However, any Erie County resident can call us at 858-2929 and schedule a test. Again, our K through 12 students and staff, you can get a rapid nucleic acid amplification test. So let's look at our the fruits of our vaccine effort labors. So here I'm presenting data of the vaccination status of a first dose and completed series among Erie County residents. So among all Erie County residents, and that includes children that can't get vaccinated, almost 65% have received at least one dose. And among the adults, 73.5% have received at least one dose. And looking at the proportion of Erie County residents that are fully vaccinated, about 60% of all Erie County residents, that's including people that can't get vaccinated because of their young age, are fully vaccinated. And a little over 69% of our adults in Erie County are fully vaccinated. So we're doing good. I hope we can do better, especially with the kids. So we are out there, again, 6 days a week, Monday through Saturday. There is a vaccine, at least one vaccine clinic somewhere in Erie County where anybody can get vaccinated. We'll vaccinate people who live in Erie County, who live outside of Erie County. Doesn't matter what country you're from. As long as you show up at our clinic and you're eligible to get a vaccine, we will vaccinate you. We are also planning to vaccinate the 5 to 11-year-olds. So we know that Verbeck recommended that the FDA authorize the Pfizer vaccine for the 5 to 11-year-olds. So we're hoping that the FDA goes through with that, and we're getting prepared. We're thinking that the most productive and efficient way to reach a large number of children in a short period of time is to host vaccine clinics at the schools. So we are working with the schools to see which schools are willing to host us for large vaccine clinics for 5 to 11-year-olds. We're also coordinating with our pediatricians and primary care offices. We're still providing them with COVID-19 vaccine doses, and when we do receive the pediatric doses, we will offer it to the pediatric and adult offices that see kids as whatever they want. We're happy to provide them. Right now, many of our community medical officers are also seeing nursing shortages, so many of them may not be able to offer their own COVID-19 vaccine clinics. So we're working with the pediatricians, and we're going to let them know what schools we will be in, and asking our pediatricians to inform their patients and encourage them to come to these clinics, because they may not be able to offer COVID-19 vaccine clinics until a little later on in the season. We're also working with community sites. And then if you never want to leave your home, you can call us at 858-2929, and a nurse will come to your home to vaccinate you. So for the booster doses, these are now recommended. For the mRNA vaccine, for people who received either the Pfizer or Moderna, the recommendation for people who are eligible to receive a booster dose 6 months after they complete their initial series. So people who are eligible are people who are seniors, people 65 and up. People who are 18 and up who live in long-term care settings, people who are 18 and up who have underlying medical conditions, and I'm sure many of us in the room have underlying medical conditions, so think about that. And then people who are 18 and up who work or live in high-risk settings. And I want to point out that a congregate living situation is a high-risk setting, so all our college students who live in dormitories should get a booster dose if they're over the age of 18. And then for people who receive the J&J dose, the first dose of J&J, it's recommended that anybody over the age of 18 should get a second dose 2 months after their first dose. So the CDC is now letting people know that you don't have to get the same vaccine for your booster as you did for your initial series. So many experts are recommending that you stay with the same vaccine for your booster as you received for your initial series, but you don't have to. There might be circumstances where you don't have access to a different vaccine, or you think that maybe you want to avoid certain side effects, so you want to have a different vaccine. That's okay. It's okay to mix and match. And at the Erie County Health Department COVID-19 vaccine clinics, we will have both Pfizer and Moderna to give people their booster doses when they're eligible. So moving on to child care centers. So as the county executive mentioned earlier, although among the entire Erie County population, we're seeing a slight decline in the number of COVID-19 related cases, we're not really seeing that in our pediatric population and our young population under the age of 18. So that's pretty much staying, pretty consistent in terms of those numbers. And then what we're really worried about is our younger kids, the kids between the ages of newborns to 4 years of age, especially those that are in daycare centers or informal, play groups, like, places where kids and parents, congregate for a couple hours or more. We're seeing a lot of those cases that we are able to investigate these cases are actually involved in either they're in daycare all day, or they're involved with an informal daycare situation. So from July through September, we found that 43% of the children between the newborn to 4 years of age that were able to fully investigate were in some type of childcare situation or in informal childcare. And actually, this trend has increased where by September, 55% of the cases between the ages of 0 and 4 years were in some type of childcare situation. So we know that kids in childcare are at risk of developing COVID-19, whether they're symptomatic or not. They still will transmit it when they get home. So this is something to think about. So we are making strong recommendations to the child care centers that they make sure that everybody who is 2 years and up in the child care center mask up. It protects kids as young as 2 as well as adults. Masking is a very, very powerful COVID-19 prevention tool. Also, we're asking the staff to make sure that they screen everybody that tries to walk in the door, not let in sick people, because that COVID-19 can spread pretty quickly, and then also report all their cases to the Erie County Health Department. So we want to help the child care centers wear masks. So we have a limited amount of, in addition to adult masks, child-sized masks, very, very small masks. And so we want to give these out to any type of child care centers, whether formal or informal daycares. All they have to do is email us at schools@erie.gov, tell us how many children, how many staff they have. If they do this by November 3rd, we will contact and let us know how to contact them, and we will contact them and let them know how they can pick up the masks. So I'm going to turn the rest over to the county executive.
Thank you, Dr. Burstein. We are still celebrating the 200th anniversary of the county. It was officially on April 2nd, 2021, but we're doing a full year celebration of our bicentennial, hence why I'm wearing the bicentennial pin celebrating EC 200. But as part of that, as well as others, we brought back the local Shop 716 program. We have sold, I think, about $600,000 worth of gift cards since we brought it back. But there are still supplies available for those who want to buy one and get a $25 free gift card. During the first week, it was $50 free. But now if you buy a $25 gift card, you will get a free $25 gift card. And they all have to be used by December 30th of this year. But we do want to remind everybody, if you bought those gift cards, make sure you use them. Spend them locally, Shop 716, and help our local economy and help our small retailers out. And if you haven't bought one yet, you can still buy one, get a free $25 gift card. It's all part of our celebration of the county's bicentennial and getting our economy back after where it was during 2020 and early 21 so that we can continue to grow as a region. With that, we'll take some questions and hopefully be able to give you an answer. Go with Jeff Preval first.
Got a question about contact tracing. It's been over a week since that Monday night game. Bills fans traveling to Tennessee for that Monday night game. Are you seeing any local community spread with fans returning back?
I don't know the answer to that question. Do you? It may be still a little early, but usually we find out in 7 to 10 days thereafter, so we should be getting that period. I was getting data with regards to the number of cases associated with direct Bills games at the stadium, which we know dropped dramatically once we had the full the vaccination status in place. I don't have, and I don't think we'll look into it, but it's possible. I don't know though. I don't have the answer, Jeff. Eileen?
What are you telling parents for Halloween? You talk about the fear of being more indoors for the fall. Trick-or-treating, I know on a federal level they've said is okay, but there's going to be family parties, house parties, things like that. What are your concerns?
Well, as always, it all depends on taking it safe with taking appropriate measures. Should be masked. It may not be a problem for the kids, but we wearing masks, but they really should be masked so they trick-or-treating going door to door. But if they do that, they should be okay. But especially if they're around other individuals that they're not normally around. If you're around other individuals that you're around all the time, you don't need to be masked at home. But if you're going to somebody's house and party, they should be. I know that's not going to be always the easiest for people to enforce, but we started to see increases last year in the fall after the holiday season, especially Halloween. I'm actually in some ways, we're always concerned with trick-or-treating, but I'm also worried about the private indoor Halloween parties for adults. We started to see a lot of cases last year in which there seemed to be COVID-19 transmission with regards to Halloween parties among adults. Now, with the higher vaccination numbers that we're at now, that'll protect certain individuals, but if you're unvaccinated and you're going to a Halloween party where there's lots of people or a location where nobody's wearing masks indoors, you're putting yourself at risk. So the best way to protect yourself, as the doctor noted, is mask wearing regardless of your age. Sandra?
Yeah, I have two questions. One is, there are some school districts that are asking for some sort of test to stay option, where instead of sending all these kids home who might have been considered a close contact with someone who tested positive, that maybe they could get tested on site, and if they test negative, they would be allowed to remain. I'm just wondering if that's something that the county is looking into or exploring. I'm also curious about what you had showed us, the slide comparing deaths for September and October of this year compared to last year. Given that so many more people are vaccinated now, does anyone in the health department have any sense as to what is causing now when you would think your intuition would tell you the opposite would be true?
Well, I'll start with the second portion because I pulled it back up on the screen. One thing we didn't deal with last year was the Delta variant, which we know is much more infectious. And that is something that just didn't have last year. We were still, I think, dealing with the Alpha original COVID-19 at that point. And even though a lot of people were going about in the fall and so forth, there were still a lot of things that were at reduced capacity, shut down. So it was not as likely to transmit it indoors, which is why we're a little fearful of November, because now everything's pretty much open, and we have the Delta variant, and what could happen once we have so many people indoors. So that is a concern. We do have a significant proportion of our population that has been vaccinated, and that's a good thing, as the doctor said. We're about 73%. The one thing I will note about the vaccination data that we presented is it's based off of the 2020 census data. So we're doing an analysis internally based off of the numbers from last year. The state and the federal government are still doing the percentages based off of the 2010 census data, which in my eyes doesn't make sense. At this point, they should just transition over to the 2020 data. Maybe it's because it won't make their data look as good because there's been growth. There's certainly growth in Erie County, and that's why the data between New York State and Erie County and the percentages of who's been vaccinated is different, because we're going 2020, they're going 2010. Now, with regards to the students, and I'll let Dr. Burstein come up and speak about this too. First off, we are following the New York State and CDC guidelines. Right now, New York State has not changed its options with regards to the quarantine period. The county has offered testing options to many of the school districts, a lot of them which have not responded at all. I'll let Dr. Burstein talk about that more, but one of the things that we talked about earlier when we discussed this with superintendents is the testing options that would be available to school districts. Some have taken advantage of it. It's not the same as the test to stay, which is a totally different situation, but not every has taken advantage of the opportunity that we have to perform testing for school settings. So I'll turn it over to Dr. Burstein.
So, as the county executive mentioned, neither the CDC nor the New York State Health Department offers any specific guidance about best practices or any evidence-based recommendations around the test to stay for people who have been exposed in the school settings. So although we have been exploring this as a possible option, we've been talking to other New York State health departments about what could be the best way to do this. Yesterday I listened to a CDC webinar about what could be the best way to do this, although CDC admits that they are still collecting data on this and they don't have enough data to make recommendations about best practices for a test to stay. And I have to admit that very early on in the school year, in the very beginning of September, we met with a small group of superintendent leadership in Erie County, and we posed the question about a test to stay option for the schools, and there was a very strong pushback from Mr. Cornell, especially. He said, schools can't do this, it's too much work, and shut down the conversation. So we haven't pursued it, and I'm actually very disappointed that if the schools really do want to pursue this as an option, that they're talking to the news instead of the health department that can help get this going. So that's a partnership, and so we are interested in exploring this, and we are gathering information right now and hoping that CDC comes out with best practices. In the meantime, the county executive mentioned that we do have other robust testing options open to the schools, which many schools haven't taken advantage of weekly surveillance testing, proximate testing, where somebody who is in a same classroom as somebody who's infected will come and test, everybody in the classroom 5 to 7 days. And that's a high school or middle school kid, that's a lot of classes, and we're willing to test them. However, many schools haven't taken advantage of this. And I can tell you right now, today, the most effective way to keep kids who have been exposed in school is to vaccinate them if they were 12 and up. kids who are 12 and up, who are fully vaccinated, do not need to quarantine at home. So that is the easiest way to keep kids in school. And hopefully in another week and a half, we can vaccinate the kids who are 5 to 11-year-olds. That'll be another group of children who will be able to stay in school if they are exposed. So that is the ticket, is to get kids vaccinated. And there are many other health benefits too of getting kids vaccinated. Thanks.
And just before I take the next question, I want to thank the parents out there who actually got their children vaccinated, who did the right thing. Yeah, there's some parents who haven't. They represent a minority. But the ones that have, as the doctor noted, if the child's vaccinated, they don't have to quarantine. That eliminates the issue. That we're basically doing is there's a very loud minority out there, and they've been a loud minority quite some time. I've seen some of the same advocates advocating against vaccines, against masks. Now the test to stay they're advocating for. The best way to handle it is to get the kids vaccinated and protect them. Yes.
Relating to schools, are a lot of the kids that are having to quarantine due to possible exposure actually getting positive test results?
I can't answer that question.
So first of all, I can tell you that many of the students in quarantine aren't getting tests at all. And if you don't have a test, you don't have a positive test. So we really, nobody has in the county has any good data about the proportion of children who are sent home for quarantine from schools because that are infected, because most kids aren't getting tested. So we really don't have that information.
Is the county pushing to get?
We strongly recommend that anybody who's been exposed, whether you're vaccinated or unvaccinated, get a test 5 to 7 days after your last exposure. However, we don't mandate that, and it's voluntary.
When we look at the numbers, we saw some what looked like pretty low lows and pretty high highs. At what point are we no longer in a pandemic or epidemic?
Well, the question was, at what point are we no longer in a pandemic or an epidemic? I don't know if we can answer that question just yet. I mean, the question is whether it's going to be endemic, it's going to be permanent, still be dealing with it. I do know by looking at these numbers, just the flu deaths alone, in prior years, we would never have seen flu deaths, especially among the young population, at the numbers that we're seeing COVID in this past year. So we're still dealing with a significant health crisis. There's a lot of people out there who have given up. They're like, I'm done. I don't want to think about it. But it's still out there. Our hospitals are still at near capacity, which has a lot of different reasons for that, some of which has to do with COVID. It's just gotten to a point now where there's a lot of folks who just want to pack it up and say, I don't even need to think about this anymore, but we still do, because there are still individuals catching it. As I noted, the 400 new cases that were recorded yesterday is one of the highest new case totals we've had in quite some time, and the best way to look at that is just, here's the new cases per week for the last 6 weeks, and I mean, if you 400 times 7, you'd actually be much higher than all of these. Let's hope it's just a one-day anomaly. I would like to think that we're all trending and going in the correct direction as a country, as a region. I would hope that's the case. We'll have a better feel for it next month, because if we can see the cases go up again, and then along with it the hospitalizations and deaths to a much higher level than they've been the last few months, we'll be wishing we had 40 or 50 people die in a month then, instead of having potentially 100 plus. We're not out of it yet. And the date in which it's going to happen, I don't know. I'd prefer it sooner rather than later. Brendan?
Yeah, this is actually for Dr. Bruce, if you could. As a pediatrician, what would your messaging be to parents of children 5 to 11 who are on the fence about getting the vaccine? And then as a second part of that question, does it concern you at all that other countries are kind of lagging behind with this age group?
So the first question is, what should I say to parents of 5 to 11-year-olds who are thinking about getting their children vaccinated? So what I can say is the Pfizer has just presented data to the FDA to show that the vaccine is very, very effective and also very, very safe. And with younger kids, they have very robust immune systems. Actually, with our immune systems, it's all downhill after the age of 20. And so kids, at that young age, they only needed a third of the dose of vaccine to have even a more robust antibody response compared to the adult trials. So we need 30 micrograms of the Pfizer, and the kids just need 10 micrograms for the 5 to 11-year-olds, and they have as good or better antibody response. So we also have some good safety data, both extrapolating from adults and then also from these pediatric trials, and shows that the vaccine is very safe. And I know that there's a lot of noise out there and people have opinions, but I really encourage parents to talk to their pediatricians. Parents should talk to their pediatricians about the COVID-19 vaccine, just like they talk to their pediatricians about any other vaccine that they get. And I know people are worried, well, I don't know what's going to happen 10 or 20 years from now. But Paul Offit, a famous vaccinologist at University of Pennsylvania, asked the question, like, how much do we need to know? How much is enough? We know that the vaccine is very effective. We know it prevents infection, and it prevents serious illness, and it prevents death. And there have been deaths of COVID-19 among children in the United States and outside of the United States. So what we know is good evidence that the vaccine is something that parents should really strongly consider for their children, to keep them safe and to keep them healthy during our pandemic. And even afterwards, when the pandemic's over, COVID-19 will always be here. So I really strongly encourage parents to talk to their pediatrician. And then your second question was about how other countries outside. Yeah, it's disappointing that countries, especially developing countries, poor countries outside the United States, don't have the same type of access or capability to vaccinate against COVID-19 as the United States. But my experience working in Africa, this is true of every vaccine. So children and adults in poorer countries outside the United States have much lower vaccination rates for every vaccine preventable disease, not just COVID-19. So hopefully the wealthier countries, including the United States, can help out these poor countries, and while we're still taking care of ourselves and getting our residents fully vaccinated. Again, this is a global pandemic, and the only way it's going to come to an end is if we can control it globally, and our most effective strategy is vaccinating.
Okay, a couple more questions. Jeff?
Looking ahead to Sunday, that's of course going to be the first home game that Bills fans are going to have to be fully vaccinated. I wonder whether the county is taking any additional steps, more so than you did a couple weeks ago or several weeks ago when Houston was here. And could you also address the issue, I guess maybe the commentary that we get, that a lot of fans went in for that particular game with fake vaccination cards? How do you crack down on that?
Well, it's illegal. If somebody comes in with a fake vaccination card, it's illegal. And we are spot checking random amounts. We can't go through every single person that comes in, but if we find someone with an illegal, we'll prosecute you. We actually have to turn it over. So for those who think it's funny, ha ha ha, they're going to go in. If they get caught with an illegal card, they could find themselves in jail by the end of the night. That's really kind of stupid if you ask me. I will note, especially with the Houston game, the vaccination status seems to have reduced the rowdiness in the crowd and the nastiness. To I believe it was the Houston game, there was not a single arrest of an attendee at the football game, which is the first time that anyone can think about that on record. So by having a crowd that walked in there showing their proof that they were vaccinated and thinking that what we saw is they were vaccinated, it also reduced on the rowdiness and probably kept out some of the knuckleheads that would normally have acted differently. We have turned away people at the gates for not having appropriate ID. If someone comes in with fake ID, they could be arrested.
Doubling our staff.
Yeah, we're doubling the staff for this upcoming game.
So could you just maybe be a little bit more specific on that? Doubling the staff, are you going from 20 to 40
I don't have the top, I don't think we have the
It'll
exact.
be more than 40.
It'd be more than 40 sanitarians, who would then have a direct line to an individual who can immediately confirm whether or not someone has ID. Or someone who's presenting as, let's say, Mark Polencars, who's fully vaccinated, is Mark Polencars and he's fully vaccinated. So we will have more than 40 sanitarians there. We'll have direct access to staff that'll be positioned elsewhere to confirm whether these individuals are who they say they are and whether they're fully vaccinated. Go to Sandra, then you.
A few weeks ago, the Erie County Legislature passed a resolution requiring that the administration provide regular updates on the status of stadium negotiations. I know that hasn't happened yet. I'm wondering if there are any plans to brief the legislature on how things are progressing with negotiations.
As always, I don't talk about the status of negotiations and publicly.
I'm just wondering if you're going to meet with the legislature to talk with them.
I will not. Council, they have council, I'm not. Legislature can't force me to do anything.
So
They're an,
no
I'm an,
one
indi-
from the administration will be
we
talking
will not be publicly providing updates to the legislature, no.
about privately.
If they could have a discussion with our council individually, but we're not gonna be providing, I mean, I've actually had some people say, be careful what the legislature wants, because they may not actually are interested in getting a deal done with the bills, which I find hard to believe. But we're negotiating with the bills like we're negotiating with the state, and the only way to get a good negotiation done is to do it among the entities that are there. When you have interference from third parties, whether they're legislators in Erie County, Assembly and Senate, or just general public, it doesn't help us get a deal done. I find it interesting that the legislature and others are treating this differently than every other agreement that we enter into. Whether it's a contract that we enter into, that could be a $50 million contract. So I would just note that the legislature and its resolution doesn't have the power to force me to do anything. If they're interested in finding out more information as county executive, then they should run for county executive.
Does that include the common council's request to look at the city of Buffalo?
Common-
Does that play into it?
The question was about the Common Council. Well, certainly the Common Council is a separate board, government. As I noted over the weekend, what I heard from the Common Council and others from the city is we'd like you to move the stadium in Buffalo. Fair point, I understand that. But one thing they didn't do is they didn't say how much money they were gonna provide to do that. So the Common Council gonna say, hey, we wanna move the stadium in Buffalo. Okay, how much money is the city willing to provide? You're gonna hear zip from the Common Council, because truthfully, they don't have the money to do it. Until they got their American Rescue Plan funds this year, the city of Buffalo was broke, facing a $60 million deficit. So I'm fairly confident the city of Buffalo would not be providing direct dollars. If they're willing to offer dollars, be my guest. They can call me and call my team, and we'll be glad to sit down with them in a private setting, not publicly, and find out what they're willing to contribute. But as of right now, there's been no offer from the city of Buffalo, from the mayor's office, from the Common Council, from anyone, as to the dollars that they'd be willing to offer to help if the team was to move into the city of Buffalo. You got one more? Anybody else? So one more hand. Yes.
Early on, Mark, there was a push for firefighters, ambulance crews, then the volunteers and stuff. Is the county going to do anything for boosters for that, or are they just basically should go out and open a clinic themselves?
The question was if firefighters, EMS, others that were early on, the county made efforts to vaccinate them, what's going on with boosters. We offer booster clinics every day. And you can contact us at 858-2929, or as I should say now, we have to, this is a public service announcement, you have to dial 716 before your phone number, so 716-858-2929, and we will offer boosters to anyone. Not just those that are in the emergency field. So I think it's important for people to understand is that a lot of folks in this population qualify for a booster shot right now. And if it's been 6 months with regards to the Moderna or Pfizer, you should get a booster shot. If it's been 2 months since you got the Johnson & Johnson, you should get a booster shot. Dr. Fauci was out saying that the Johnson & Johnson probably should have been a 2-shot regimen to begin with. It was all hey, it's a 1-shot. Dr. Fauci announced last week, it probably should have been a 2-shot one to begin with. So if you got the Johnson & Johnson, and it's been more than 2 months, you should get another shot. If you are Moderna or Pfizer, there's a qualification level of 18 and above, but everyone 65 and older is recommended. Any basically 50 and older, you pretty much should get it. And if you have a underlying condition, you really should get it. And then with those 18 and older, it's recommended regardless of whether they're in one of these long-term care settings or not. So it is important that people understand that the booster's out there to protect. And people are like, well, the shot didn't work. No, it did. But the one thing that we are dealing with now that we weren't dealing with, especially when I got my first dose and second dose of the Pfizer vaccine back in March, they weren't talking about the Delta variant then. We know the Delta variant is very infectious and very virulent. And that's why they believe with the booster, you are so much more protected against Delta than you would be without it. And so that's why it's important for people to understand. Call us, 716-858-2929, numbers on there, and we'll even come to your home to vaccinate you, including for a booster shot. With that, it's been about an hour. I appreciate everyone's attendance, and thank you for coming today. It's the first time we've given an update on COVID-19 in a while. Thought it was appropriate based on the numbers that we were seeing with regards to deaths. And then, of course, we had a big day yesterday that we didn't even expect that when we scheduled this originally, but we had a big COVID day yesterday. I just ask everyone to be safe, be smart. We are going to be entering the months when most of us will be spending the vast majority of our time inside with others, including those we may have not been around for a while. So wear a mask, especially in the public setting. If you're indoors, it makes sense. I have to admit, I've gone to places, I'm wearing my mask, and people are looking at me like I got a third eye. Like, why are you wearing a mask? We know you're vaccinated. Well, we also know that vaccinated people can get sick and catch COVID. They'll be in a much better position as someone who's unvaccinated. But if you're unvaccinated and you're going out there now as we get to these colder months, we're indoors and we're seeing a continued spread of COVID-19 in our community, you are at high risk. If you cannot get vaccinated due to underlying health condition, I feel sorry for you. I really do. I understand your predicament. And that's why we need the rest of us to get vaccinated and wear masks when appropriate so that we can protect those individuals who otherwise cannot protect themselves. To all, be safe and well. Take care, and let's root for a big victory when the Bills squish the fish this weekend. Take care, everyone.